on the station that's on your side. This is Channel 7 News Daybreak.
Welcome back. It is 6:23 here on Daybreak. Well, lots of folks, probably someone you know, maybe you yourself, coughing, sneezing, something many of us refer to as the crud. In fact, Baptist Health's Dr. David Gerson with Sherwood Family Medical Clinic calls it the creeping crud, and he's here to help us sort it all out and what's being spread around. It does seem like so many of us are dealing with this time of year, especially.
Yeah, I mean, it really kind of just started at Christmas time. I think all the families got together and started passing it back and forth, and it's really just continued through February. I'd say probably about half my visits for the last 4 or 5 weeks have been this creeping crud, sinuses, flus, streps, those kinds of things. What is important is about half of those patients, though, it's actually not an infection, it's actually sinuses, it's allergies. People think, well, we're still in wintertime, what the heck are allergies doing? Oak trees start to come out around that first week of January. And so we try to differentiate that in the office and try to convince a lot of the patients when they don't have a fever and don't have the bacterial or viral symptoms, hey, this is allergy and you need to be on allergy medications.
Gotcha. Talk about treating it ourselves because oftentimes antibiotics, something that a doctor prescribes, is not going to work for these viral infections.
In fact, probably only about 2% of the time, 1 out of 50 is antibiotics really going to be appropriate.
Oh, wow.
What I was saying before the segment, you know, treat all these things like it's an allergy to begin with. Start with something like a Zyrtec or an Allegra or a Claritin. Start with a Flonase or a Nasacort nasal spray. Those will, even if it is a virus or a bacterial infection, those will also address the symptoms that are bothering you.
Okay, and then let's talk a little bit about, there's some other things, rhinosinusitis.
That's the rhinosinusitis. Yeah, rhinosinusitis is just, we're basically describing what's going on in the head, and that can be caused by all those things we just mentioned. Allergies, viral sinus infection, bacterial infection, and the flu.
Okay, and this lingers. This is not going to go away in 2 days.
So the thing we were talking about just a little earlier is what's very common in families, you know, or the kids bring it home from daycare from the school, mom and dad get it, the kids get over it, dad and mom have it, and then they pass it back to the kids. We'll see it where families will pass this stuff back and forth for, you know, 6, 8, even 10 weeks.
Not the kind of news many of us wanted to hear.
No, but you know, you can't, but you know, remember, don't forget grandma's remedies, you know, the nasal saline washes, the saltwater gargles, bedside vaporizer. I'm a big believer in Vicks Vapor Rub on the chest and the vaporizer, chicken soup, hot tea, and then, like I said, the things like the Zyrtecs and the Allegras, the Flonases, and what's really good now, just in the last year, all these things have become generic. And the generics, you know, the commercials are great, but the generics work just as well as the name brands.
Great information. If it gets worse and it doesn't go away, they do need to see the doctor.
Yeah, especially if you've got a fever above 100.5, if you're getting pain in just a single sinus, or even I know a lot of people don't realize this, if your upper teeth are hurting, that can be a sign that this is actually true and blue bacterial infection. Time to come on in and see us.
Okay, great information. As always, Dr. David Gerson, thanks so much. Here's the Baptist Health Helpline. If you have any questions, you can always call 1-888-BAPTIST.